diseases. And as we see on that screen there, we've got a lot of people who are going through these conditions. These conditions are issues that have become predominant in people's lives. When we talk about breast cancer, prostate cancer, when we talk about fibroids, irregular periods, hot flushes, infertility, low sex drive, PMS, ovarian cysts, menopause, bloating, erectile dysfunction. Many people sometimes live with these conditions. They live with these disorders as part of their life. And sometimes they've come to a point where they've not even found a way of really solving them or dealing with them because they've just accepted them as part of a way of life. But if we go further, there's more and more people who are, whenever you look at any situation, they're going through challenges in the fact that their system has become compromised either by the fact that they're going through memory loss or having polycystic ovary syndrome or hair loss, insomnia, prostate congestion, irritability, anxiety, hair loss. But where's all these things coming from? Why is it that today in 2020, when the Creator has given us a temple to live in, we are having a situation where our systems are actually being compromised by hormone imbalance? And what we're facing today is a situation where people constantly are in a state where they have nowhere to turn or no understanding of why these symptoms are coming about. That's why today in the Mariandina Research Foundation, we've put together something for you around hormone health. One of the things we're seeing today is that we all have hormones, okay? Hormones are things that actually help us to communicate. They're like messenger systems for the whole body. They help the body to communicate, to help the body to really relate to everything around it. One of the things that we're seeing, as we know that we are a product of our environment. What does that mean? It means that our body is constantly responding to the environment. Now, as you see on the screen there, we have the hypothalamus, which is the master gland that actually is also producing vasopressin as a hormone. It produces dopamine, which is a hormone for mood. And also we have the thyroid gland, which is very important for metabolism, producing T3 and T4. And also we have the liver, which produces glycogen. We have the adrenal glands, which produce cortisol and adrenaline. We also have the kidneys, which produce renin. We also have the testes, which produce estradiol. We also have the pineal gland, which produces melatonin and serotonin. We have the pituitary gland, and this is also producing thyroid stimulating hormone, as well as FSH, and also luteinizing hormone. We also have the thymus gland. This is very important for actually helping us to prepare our immune systems to give them the right amount of, prepare the T cells so that the immune system can actually function optimally. We also have hormones that are produced in the stomach as well, like gastrin, histamine. For example, you find that also our pancreas, which is so central to our blood sugar control, is also producing hormones like insulin. And you also have the ovaries producing progesterone and estrogen. All these hormones play an essential role in our well-being. In fact, what is so interesting at this moment in time is that every part of your system is based on what also your brain is directing, because your brain is also producing several very important hormones. And literally, it literally means that you are in a situation where you have to now be in a situation where you can actually begin to actually understand that your brain is constantly producing these feel-good hormones. For example, serotonin.
So Stephen, these hormones that you're talking about, for people that this may be the first time they've been introduced to hormones at this level, just to clarify, hormones are the chemical messengers that tell our bodies what to do. So for example, from childhood to puberty, am I correct in saying it's hormones that will influence that growth, that difference in developmental stages? They tell your body. So for a woman, hormone levels will tell you to produce female organs, such as your breast, your all the things that make us transition from young girls into women. So that's how important hormones are. They tell our bodies what to do at a certain time, and as you said, they're very responsive to external factors as well.
You know what is so important, I'm glad you said that, Rebecca, is that we're in a situation where we're realizing hormones actually are messengers to every aspect of our system. And many times we know that the changes occur at puberty, changes occur as we have a change of life when we're going to, for women, when they're going to menopause, men, they're going to something similar called andropause. And at the same time, we also know that hormones can affect us at different levels in our life. Some people get different conditions. Women may get premenstrual syndrome. Men may have a situation where they have erectile dysfunction and many other challenges that face And as we shall see as we go along, men can have up to 80 different symptoms that come about as a result of hormone imbalance. And women can have also another 70 symptoms that affect women. But what we also have to give thanks for is that hormones are also very delicate in terms of the fact that whenever our hormones are in a state of what we call communication, they have something called hormone receptors that receive the messages. And it's very easy for now that the hormones to actually start to begin to move into a situation where they become blocked by what they call hormone disruptors. And the hormone disruptors are things that actually mimic our hormone. So they cause what they call hormone disrupting messages. So eventually, just as we look at that screen, we look at the fact that our body produces all these hormones, and from the endorphins to dopamine to serotonin to oxytocin. Oxytocin is the bonding chemical, and it also is chemical responsible for arousal. At the same time, the mood we have at any point in time, our sense of well-being, our appetite, our sleep is all controlled by serotonin. Dopamine is about acceleration. In fact, it's a neurotransmitter that allows the body to really communicate that sense of bliss. And also when we've just been doing exercise, we get this sense of endorphins that get released and we get a feeling of euphoria. So we look at hormones in terms of the fact that the body is always tuning us into a sense of balance. It's always allowing us to move into a sense where we can begin to appreciate the fact that hormones actually are very important for the way we feel. But also, most importantly, when we look at any situation, we've got to remember that we are all realizing that these powerful chemicals are actually produced in special glands. And I just want to take the pancreas for the beginning point, is that our pancreas is producing insulin. And one of the main ingredients it needs to produce insulin is chromium, okay? If you have low levels of chromium in your system, you cannot produce insulin in cells in the pancreas called the islets of Langerhans. And in fact, we are now realizing is that everything that we're doing at this moment in time is that whenever you take, the body's trying to balance blood sugar. If you have too much sugar in the blood, the body wants to move the sugar out of the blood into the cells. And if you have too little blood sugar, it tries to actually compensate by releasing sugar into the blood from the storage in the liver. So many times you find people have got type 1 and type 2 diabetes that have been compromised by different issues. I also put it the thyroid. The thyroid is so important. Many people are suffering from thyroid imbalance. And many people have got problems where some people have cut out their thyroid. Other people are in a situation where they're taking thyroxine. Other people are in a situation where their thyroid, which we know is in charge of metabolism, is actually very important for generating energy and burning fat. But also, most importantly, is that we're seeing that the thyroid can bring about up to 10 different symptoms. One may have what they call insomnia. One may have a situation where they have decreased libido. One may have a situation where they are having excessive weight gain, or they're having brain fog, or they're moving into a situation where they're experiencing what we call cognitive impairment, or they're in a situation where they're experiencing a sense of what we call muscle aches, body aches. All these things can actually come from thyroid imbalance. This then has a knock-on effect on the immune system, and the immune system doesn't actually work very well and doesn't actually bring about a sense of well-being, meaning that it compromises the way the immune system works. So look at your thyroid as the main conductor of the orchestra in your body. And this is what allows the body to do what it does. So the thyroid plays a key role as in metabolism, but also direction and directing things in the body. Now, we also know that as we look at the pancreas, they're not producing enough insulin, and that's because most likely they're low in chromium levels. And sometimes you find that people go into what they call being borderline diabetic for a long period of time. They are in a situation where they're having some sort of the early symptoms of diabetes, starting like frequent thirst, or they're having frequent urination, or they're having a situation where they're not actually quite able to actually understand why their body doesn't feel good within themselves because of, again, of high sugar levels in the blood. But what we're finding is that if you are taking something like Mariandina, which repairs the pancreas, which gives the pancreas an insulin production capacity, which with the chromium, today you also find that if you're low in magnesium, you will also have poor insulin resistance. This is in type 2 diabetes. In fact, a lot of the adults over 30 years old will be tending towards what we call this issue of having what we call poor insulin control, because of the fact that as we age, our hormones start to decline. And also many other factors can bring on what we call unstable blood sugar. Even hormone imbalance is also linked to unstable blood sugar, and can also be linked to what we call hypothyroidism. So you find that everything is interconnected. But since we talk about hormone health here today, we also want to connect it back to what you're saying, is that many times we find that a lot of people sometimes go into a state of what they call diabetic shock, where they need a quick sugar boost, and they might take a little bit of piece of chocolate just to raise their sugar levels. But also sometimes you find that for some people, they're starting to gain weight because of, again, of poor blood sugar control. And the body is always trying to make sure that it balances. Like you said, what we're saying on the screen here, diabetes increases the risk of heart disease. It doubles the risk of stroke. It's the #1 cause of blindness. It's the #1 cause of amputation in the world today. It is also it increases the risk of breast and uterine cancers. Today, we're also saying that people are being, the extremities get damaged in terms of people get glaucoma, they get what we call cataracts, they have kidney damage, and they also may develop gangrene. All these are damage to the extremities of the body. But what is most important here is to remember that our systems are always seeking balance. Today, we want to remember, as we're looking forward, is that whenever we want to look at your system, we want to also know that your system is constantly burning nutrients, and it needs those nutrients to be replaced.